Good morning. So let's start with a small topic, that is Fissure Sealants. I hope this is not covered for you. Is it? I've taken for the previous batch. I've not taken for you, right? So I think all of you have done Fissure in the department? No. How many have posted in the department? Have you seen Fissure Sealants?
Yes.
No. Any idea what is Fissure Sealants? What is it? Seal the pits and fissures, right? So why you need to seal the pit and fissures? That is prevention. So we are just not pediatric dentistry, we are pediatric and preventive dentistry. So prevention means to stop from something happening, right? That is prevention. So to stop caries, you can do Fissure Sealants. Why you need to do Fissure Sealants? I tell you. First, before that, what is pit? This is all Viva questions, okay? So you answer most of the things. The staff will ask you, what is pit? It's a small pinpoint joint. Okay, that's pit. Whereas fissure is a deep cleft. I think all of you have done dental anatomy carvings, right? The first and second year. First year, well. So in that you have done carving, pits, fissures, fossas, that is done, right? That is pit and fissure. Now there are 4 types of pit and fissures. One is B type, one is U type, I type and K type, like our alphabets. So B type and I type, that are self-cleansing. What do you mean by self-cleansing? When we eat food, it does not get stuck. It will clean by itself. Right, out of stuck. That is self-cleansing. But I type and K type, they are more constricted. I, K. Such cases, what happens is that the food will get stuck over there. Whenever you eat toffees, candies, or leave any carbohydrates, you are supposed to get caries. If you eat frequently, I'm not telling if you eat 3 meals a day, you will get caries. So to prevent that, they have introduced something called pit and fissure sealants. There is some history behind that. Prophylactic odonto. Have you read this conservative edition? Prophylactic odonto. See, Hayat is a guy who introduced this in 1923. He told that let's include all the, anyways it will get for the teeth will get caries, so we need to include that also in the restoration. Even if it's not caries also, we will do restoration. He thought that this is going to definitely get caries, so just restore it. Then later, somebody introduced, Buonaccorsi introduced anti-stitching technique. Anti-stitching everybody knows, right? When we use HN, there will be micro tag formation, composite restoration, basically composite restoration. So, this is a little bit of history part. Classification, I need to write this from the textbook. This is just a slide. There are 4 types of different types. Generation wise, first generation, second generation, third generation. Like that is there. So next class assignment is just write the classification. Normally pit and fissure sealant is asked for 10 marks. So it will be like define pit and fissures, classify. So definition, classification and all will get a mark. So classification is very important. According to color, transparent, opaque, tinted. Then according to fluoride content, that's fluoridated or non-fluoridated. What is the advantage of fluoridation? What is the advantage of GIC over the other restorative machines? Fluoride release is there, right? So added benefit are. All the restorative materials will have some benefit, but fluoride has anti-carcinogenic property. The anti-carcinogenic property is imparted by fluoride. Similarly, that we can use fluoridated pit and fissure sealant for added benefit. Then according to filler content, unfilled, filled and semi-filled. Then effectiveness, I told you, the food will get over the, step over the fissure area, so that when we brush, it will not reach directly to that part. So if you seal that, you can see the deep cleft or deep fissures, the food particles will get embedded and it will not be easy to clean them with normal brushing. So when you seal this area, if you seal, it's much better. You see, the food will get just passed on, it will not get stuck over there. See this picture. See the toothbrush, there's sealant placed. So you can effectively clean such area. This part is already covered or sealed. Then composition, BGMA and DMA, certain reaction, yttrium fluoride. Now, what is the recommended age? We cannot give sealant for what's the most imagine a 3 to 4-year-old kid. What are the dentition we are expecting? What is all deciduous, right? By 3-year-old, all the molars, first molars, second molars, that means B, E, primary first molar, primary second molar, everything is erupted. All the teeth are erupted. That's a good age to give sealant. Now 6 to 7 years. What happens in 6 to 7 years? First permanent molar. Then 11 to 13 years. Second permanent molars and premolars. So this is the ideal recommended age because whenever it tooth erupts just into the oral cavity, that's the most, what do you say, time chance to get caries